Welcome to PG Pulse, Press Ganey's podcast on all things healthcare, tech, and human experience. In this podcast, we'll be joined by some of the best and brightest minds in the industry to discuss challenges, share insights, and innovate the future of healthcare. Thanks for tuning in. We hope you enjoy the conversation.
Welcome to PG Pulse, a podcast where healthcare leaders talk about innovation in human experience area. I'm Brad Fetters, president of Press Ganey Consulting. Today I'm joined by Dr. David Lubarsky, CEO and president of Westchester Medical Center Health Network. David joined earlier this year and has been leading a robust transformation centered on providing the safest and most connected care environment for both patients and caregivers. Today we'll be diving into how he's aligning his team around safety, patient experience, workforce engagement, social capital, and partnering with Press Ganey to make material and sustainable changes. David, thank you so much for joining us. And maybe to start with, just jumping in and telling us a little bit about Westchester Health Network and why human experience is important to you.
Well, first of all, thank you very much for having me. It's a great opportunity and especially important since I'm not even here a year to, I think, let other people know about what an important part of the healthcare ecosystem the Westchester Medical Center Health Network is. For an area that's 6,200 square miles, we serve an area that is larger than the state of Connecticut. And while our hub is in Valhalla, New York, which is part of Westchester County, and has been a stalwart provider of healthcare for 100 years in this region. Matter of fact, it was the place that trained me 40 years ago as a medical intern. It's one of the reasons I came back here, because it is home for me. I grew up down the road from here. It's grown into this amazing network. It was a county hospital when I trained here, and it is still an organization driven by its mission to take care of the underserved and without regard to the ability to pay. And, you know, that is something I really treasure, is the ability to deliver health care to people because they're people, because every person deserves access to great health care. But the organization has grown tremendously in the last decade. It's now 9 acute care facilities, 3 nursing homes, see 400,000 unique patients a year, a couple 100,000 ED visits. We get, as far as we know, the most inbound inpatient transfers of any hospital in the United States. We get 14,000 this year for complex care. And we are the only real TQ center in the entire Hudson Valley where we operate. We serve about 9 different counties. We're the only level 1 trauma center. We get about 5,000 trauma admissions a year across the network. And we're 10% of all of the trauma centers in the state of New York. We're the only full-service children's hospital in the entire Hudson Valley, the only burn center, the only comprehensive epilepsy center, the only comprehensive stroke center, the only organ transplantation center, as a matter of fact, and the largest mental health provider on top of it. And so all of those things combine to make this organization incredibly important as a hub, but also all these other smaller more community-based hospitals ranging from 230 beds down to 15. One is a critical access hospital that really have an obligation to serve, an incredibly diverse population, from the elderly to the rural to the semi-urban, like in Kingston, the lovely little city, and Poughkeepsie. We're all over. And the ability to extend our care and our caring to everybody is absolutely critical. It's absolutely critical.
Wonderful. So what prompted you to look at a external partner, start looking at the human experience at Westchester?
Well, as you know, I have a long history of working with Press Ganey and have counted Dr. Tom Lee as a friend, advisor, and mentor for a couple of decades. He always seems to have the right answers, which is why I would like to be able to do that. In talking to him about the challenges, I came here and, as with many organizations, had tremendously dedicated and committed leadership, but the entire team had been in place for a couple of decades. And I thought that with some fresh eyes, we might better engage our workforce and move from being a good organization to being a great organization. And I believed that Press Ganey could help us do that. And the human experience, again, like many, many places that are built around caring for the underserved, caring for the acute care, emergency medical admission, which is the thing that we're most known for, perhaps we had let slip a little bit the patient friendliness when life didn't hang in the balance, and that the expectation that our employees would just do their job and, maybe they didn't need the support that, frankly, the new generations expect in a workplace. And so I thought that Press Ganey could really help us move towards where I want us to be, which is to be the provider of choice, not by necessity, but because everybody really knows that if they come here, no matter whether it's a little problem or a life-threatening problem, they're going to get great care, and that everybody wants to work here. Not, okay, it's the most exciting place around. Yes. Is it the best place to work? I want every single person to believe that, who's in our organization.
Wonderful. The outcomes of insights, data's findings, did they surprise you? And did it challenge the current assumptions of your leadership team?
I will say that we were a little surprised that Press Ganey worked with our teams to do a very comprehensive assessment on an initial survey of our employee opinions. And we already knew that our HCAHPS were not at the top of the nation, and there was a lot of room for improvement there. But we were a little surprised, frankly, that the workforce did not feel truly engaged or really necessarily supported in speaking up. And so we immediately moved to launching a comprehensive employee survey. And with Press Ganey's support and advice, we far exceeded our expectations. We hadn't done one in years, and we got 67% of our workforce to participate. And that's number one, right? Number two is the hard part. We actually have to read each and every single one of them and actually respond, even though they're anonymous, but respond to all of the themes that were brought up about what we could do to make the workplace better and our patients safer in the opinions of our staff and faculty. It's not all complimentary, but again, important work is not always pleasant or easy work. And the most important thing you can ever do in going from good to great is to stop pretending that you're great already, right? So, and Press Ganey has been really, really helpful in helping us lay out a roadmap. How do we get from A to Z? And Brad, you may or may not know this, but I think we now have 175 separate projects and steps to go from good to great, because it's not an easy journey. It's not a short journey. It's not a quick journey. It's a dedicated journey.
That focus on finding the truth, do you think without the Press Ganey human experience assessment, internally you guys could have unearthed this and laid out the plan?
No. First of all, I'm sorry, but most people inside an organization, they're not paid to bring bad news. They're not, right? And if they've been here a while, if they bring bad news, there's probably some concern that that bad news will be seen as they are doing a bad job. And so it's very important to bring in an outside organization, but also to make sure that the people inside the organization know that it's a new day. That if we uncover things that may not be complimentary, we're not going to say, oh, you didn't do your job before. Don't care. It's about what are we doing to go from point A to point B, from where we are to where we want to be. And I think the entire team has bought into that. Press Ganey has been supportive, but also understands the difficulty when they're bringing, our not perfect survey results to the leadership's attention. And I've been really impressed with my team for just stepping up and saying, okay, we've got some issues. We're going to tackle these because our employees deserve it. And most importantly, our patients deserve it. And we need to listen to our employees.
You mentioned the sheer amount of work required. How are you going about prioritizing that work with your team? It seems like most organizations, it's just one thing on top of another thing. How are you dealing with that?
As you know, Brad, I've been impressed with Press Ganey for a long time, and UC Davis went on a similar journey. When I got there, I was the CEO there for 7 years, and I think Press Ganey recognized the work that we did there. But we went from not having a really engaged workforce and not being at the top of the nation for patient experience, and when I left, we were the most highly ranked public health organization in the U.S. to work for. And that led to having one of the top 5 mortality rates in the United States for the last couple of years I was there. Because a really, really engaged workforce provides really great care, and they get really great feedback from patients, and then they provide even greater care and more attention, and it's just a positive, virtuous cycle. And so I know what it takes to do that, and it doesn't matter where you're starting from, as long as the administrative leadership and the clinical leadership get together and decide that, you know what, good is not good enough.
I'm going to ask this question. You just answered it great, but I'd like to lead in with this question, which is for those organizations not performing where they want to go and struggling, where do I start? You've done this at UC Davis. You're starting it now. What's imperative, and where should they start?
I think that the really most important part is that we look at what's most important to the organization. And in this case, the culture of safety, the ability to stand up, speak up, and know that not only will you be heard, but that your concerns will be responded to in a positive manner, wasn't prevalent. And so that's probably the most, in this particular organization, that was like the number one thing to do. It isn't the same at each organization, but it's understanding what's standing in the way of important issues that the entire staff can really recognize. And that one stood out to me. It wasn't there aren't areas to improve, but you'll never get better if you don't face the things that you don't do well. You'll never get better, right? It's like saying, hey, I can't make an omelet, but no one ever shows you how to whisk the eggs. I mean, you got to say, okay, I don't know how to make an omelet. I got to get some help figuring out how to whisk the eggs right? It's that simple.
Wonderful. What myths did the HX assessment debunk inside the organization, or at least put aside?
The assessment that Press Ganey did really was sobering, in the sense that we thought we would score well on a vast number of the questions being asked. The staff did not rate us as highly as we thought of ourselves. So I think we're in an echo chamber sometimes at the top of the tower in the administrative reaches. I'm as guilty as anyone. I know I come to work every day thinking, in every job I've ever done, I'm trying to do my best. I'm trying to make a great organization. I'm really trying to take good care of patients. And I assume, right, that the people who are actually doing the real work, right, not the administrative work, people on the front lines doing the real work, know that, feel that way. And I don't think our administrative team, when I first got here, realized that there was a slight chasm between I know what their intentions were and what their hard work was directed to accomplish, and how appreciated that was at the ground level. So it meant that communication was not as robust as perhaps we had thought, and I take that on ourselves. If someone brings up a question or an issue, and you look at it and you address it, or you attempt to address it within the confines of your resources, you don't communicate back that we heard you. We looked at the issue. Here's the solutions we're proposing, the timelines of implementation. And that person just assumes their voice went into the moon, right? They don't know. So we've got to do a much better job. And that's part of my commitment, is to get the input from our staff and our faculty and to go back to them every single time and say, and show them, we heard you. You were either right or maybe you weren't right, but we heard you, and here's what we're going to do if there is an issue to address it, and here's how long it's going to take us to do it.
Now that you have the data, the insights, the plan, how do you start shifting the culture? That's a big lift.
You know, they say culture eats strategy for breakfast. Everybody says you can't change culture and stuff, and it is. It's tough, but you can't change culture. You absolutely can change culture, but it has to start with introspection. And the first thing, when we say things have to change, we rarely think that those things are ourselves, right? So at the end of the day, I challenged our administrative leadership to change the way that they thought, to really look at themselves every single day. And it might be with some prodding from the boss, I'm just saying, that if they weren't acting in a truly team fashion, if they were thinking in a silo mentality, that we had to wipe that out. If someone was bringing up a problem, that the answer wasn't to diminish the problem, but to explore the problem and to make sure that we didn't let any balls drop and that everybody was accountable not only for what their job was, but what for all of their colleagues' jobs was or were, right? And because it is that team ethic that drives great patient care. If you're not modeling it in the C-suite, you're going nowhere with asking other people to do it. So first and foremost, lead by example. Second, be absolutely consistent and unrelenting in the messaging that we're here to take care of everybody. There are no second-class citizens or no second-class employees. Someone who works in an outlying hospital is no less important than someone who works in our main TQ hub. They are all equal in the eyes of the administration in terms of their value to the mission. And again, in a lot of systems, there's a sort of hierarchy of which place is more important. You've got to dispel that. Everybody is integral to the pursuit of the mission of bringing care, better care, more complete care, closer to home in a way and in a timeline that patients want to get it, right? And everybody's critical in that delivery. So that's number two, which is being absolutely clear about that. And also that we are going to honor what we say. We're going to mean what we say, and we're going to say what we mean. We're not going to say, well, yeah, we said that, but we didn't really. That's gone, right? If you're working with me, you tell the truth. Radical transparency. If we're not doing well, share the results. Where we're doing well and we're getting ranked and we're getting national recognition, laud that and hang the banners, but don't shy away from facing those things that we're not doing really well so that we can, people are self-correcting in healthcare. If you show them the data, if you show them they're not doing as well as the guy next door, or they're not doing as well as the city, across the state, and they have a similar profile of care that they're providing, it's an incredible incentive. You just have to be transparent that with your benchmarking, that it's appropriate, and raise the level of performance by expectation.
Through this transparency and a new accountability, are you starting to see some early signs that the culture's shifting?
I am. First, people are starting to turn out for the town halls. I had one this morning. It had, about 500 or 600 people who showed up. It's not a ton. It's only about 5% of the workforce, but it's a start. And so that's the first thing, which is that actually, at least some of our employees want to hear what the administration is up to and what we're planning and so forth. The second part is that we've already turned around organizational performance. So you have to also believe in yourself, and you have to promote people who are doing a great job. We were in some financial difficulty when I arrived, and we were working on a major turnaround plan with Huron was our consultant. And, we far exceeded those expectations. We've already realized about a $200 million P&L run rate improvement it's only been 8 months that I've been here. And, people, they dig in and they see that, wow, I'm working hard and it's happening and we're following up on it and we're providing the resources to achieve those results. That resonates through the entire organization. And to that end, that's how you build a culture of performance and capability, which is you don't tell people to do the impossible and you don't expect them to do the possible with no resources, right? So again, we have 38 major projects going on here, stem to stern, just saying, okay, each corner of the organization, not just our trauma, not just our comprehensive stroke center, every corner of the organization needs to perform at the top level that the United States sees.
You talked earlier about your relationship with Tom Lee and his passion around social capital. What does social capital mean to you, and how important is the work you're doing with Press Ganey and changing the culture?
Right. Well, at the end of the day, it's that old statement about, people won't die for a ribbon, people won't die for their country, people die for the guy next to them in the foxhole, right? They'll give anything to help their platoon members, right? So number one, we're teams, right? We're teams in the trenches, right? Healthcare is pretty tough work these days, especially on the front lines and taking care of patients. And they get sicker, and the work gets harder and more demanding. And so counting on your team members, and also making sure your teammates know that you're counting on them, is a critical component of becoming a better organization, and that you can count on your leadership as well to back you up. And it's about the idea that, and if someone is not doing that, is that you offer them help whenever you can. But when they're not pulling their weight and they're your friend, it's okay to step up and say, hey, I really wish that you would have helped me take care of this patient. You were on your break. I know you were on your break. It's not right, but I was really struggling, and I really would have liked. And if you have that relationship with your teammate, they're going to step up next time. And the thing is, of course, you'll find a way to pay them back. I don't know, spell them for an extra 15 minutes on your next break, or whatever it is that you have going on, right? But the ability to just turn your relationships into a positive for a better work environment and for better care of patients, it's a really important concept, and that you won't be castigated for suggesting that someone do a better job.
For a leader that maybe has not thought about social capital as much, what have you learned as a leader about social capital and how it can accelerate performance in all areas of the organization?
If people feel, number one, safe, that they trust that their leadership is invested in great patient care, invested in their performance as a professional, they'll be willing to take chances to do the right thing. And that's what you always want, is right. It's like, I don't know if I should bring this up. Like, yes. So that's really critically important, that they know that they have social capital with us because we trust them and honor them as employees, or faculty members, as the case may be. And you'd be surprised. Some things are so simple to fix that they just haven't brought it up because they didn't feel comfortable, right? And they didn't feel like they had social capital with the people who were, in the administrative levels. So I think that's really critically important. And we're going to see that you need to build social capital. It's an iterative process. They have to trust us, and then we have to hold them accountable and make clear what our expectations are, and that it's a transparent process, and that they should feel comfortable if we're saying, hey, we need to do a better job here. And we need to be comfortable if they tell us that, wow, you're not supporting us in the way that we need to be supported to accomplish our patient care mission, or in making this a great place to work. And feel comfortable that they're safe in doing so.
Have you seen something most important about giving caregivers that safe space to speak up?
So, yes, I think that you have to encourage. You have to go out and actually ask people in person. I can't stress enough the importance of rounding and getting off the C-suite floor. We all are here. You're sitting at a conference table on the C-suite floor, but getting out and talking to the people who are delivering care, the doctors, the nurses, the physical therapists, the radiology techs, the phlebotomists, just asking them, what can we do better? How are we doing? Right? Making formal rounds on a unit in the pediatric hospital. And, believe me, there's nobody like pediatric nurses to tell you what you can do better. And that's the way it should be, right? And if there's anything I can ever do to meet those observations, right, with action, I will, right? And because everybody, I find, is almost without exception. I actually can't think of a single instance since I've arrived here where people gave a mean-spirited comment, right? There were some issues, right, that they brought up that were, like I said, a little uncomfortable, but just spurred me even more to look into it and get our team focused on getting that fixed.
I know that you read every patient complaint or compliment that comes through the doors.
I do.
Are you starting to see this work impacting the patient experience and the responses to you?
Yes, of course, letters are just the extremes, right? You've really, really done an amazing job, and someone has to tell you what a difference you made in their life. I love getting those letters. And then there's the letters where, wow, you realize we didn't do a really good job here, or we dropped the ball, or we were rude, right? Or we didn't understand that we were not helping the patient. And it's usually not the patient, it's actually the patient's family that is most prone to write a letter of complaint, because they're looking from the outside, if you will, and they're seeing that their loved one is not getting the treatment that they would give their loved one. And that's what we should strive to do, right? We should strive to be every bit as compassionate and communicative and respectful and accessible as whoever's their support person at home. And we do a pretty good job of that, but not always. And so I think that's our goal, right? Which is every single patient encounter, every single day a patient is in our clinic, every time they're in our hospital, it's a high importance encounter for the patient. I want every one of our staff to feel that every time they talk to a patient. It's of high importance too, because the patient sure feels that way, right? And yeah, I am seeing a little bit of a change. I'm getting a lot more complimentary letters lately. Very happy about that. And to be honest with you, I'm going to be honest that the negative letters, right, have forced me to take a really hard look at some of our mental health offerings, because it's hard, right? There's so many differing perceptions, and there's a lot of misunderstandings. And in many instances, and I've gotten a couple of letters and complaints about how loved ones, people have loved ones undergoing involuntary commitment, and they're not sensing that respect. And then when I really look into it hard, it turns out we are actually really doing a really good job, almost uniformly. But we're not doing a great job speaking to their loved ones about why these treatments are the way they are, why are the restrictions on movement perhaps the way they are, why is the bedding the way that it is, right? It's for safety, it's for compassion, and it's because there are actual regulatory care environments. But it's convinced me that we need to do really a lot more upfront work with families and loved ones when we have patients who are in our inpatient units in mental health. And so that's why it's important that I read them, because other people might read them and say, well, we had to do this, and this was the right thing to do, and then it sort of perhaps stops there, as opposed to we can't have anybody who might get a survey, frankly, thinking that we don't care. If we do care, if we don't care, that's on us. But if we do care and we're not doing a good job demonstrating that care and commitment, we got work to do.
The healthcare market is full of consulting firms knocking on your door. What made Press Ganey stand out to help you do this work?
To the point of pandering, you guys are the best. I'm sorry. But that's actually the truth. You guys are the best. And the level of insights you bring from the national corpus of work, the insights that you've obtained from other organizations that can inform what we can do. Because you know what? Nothing that we're doing here is exactly rocket scientist work. It's more like building a go-kart, It's like 4 wheels, cardboard box, maybe a little motor if you're fancy. Really, anybody can do what we're setting out to do with the right level of commitment and the right level of guidance. And that's the key. What I think Press Ganey brought to us was, or what I realized Press Ganey would bring to this organization, was that roadmap, that plan, a comprehensive, don't leave anything out so that we can go good to great. And that's what made you guys the choice for us to go with. One of the things I've always been impressed with in all my working with Press Ganey for, it's a couple of decades actually, across 3 or 4 different organizations, is their commitment to transparency, their focus on data, and their ability to bring benchmarks and expectations and let you know where you stand in the pantheon of performance, right, across like organizations. It's so critical to change the discussion about, well, we do this, yeah, it's not really as bad as that. Then you see, oh, on this, we're really at the top of the nation. And on this, we're really not on the top of the nation. And that's why this helps me. It's not only about doing better patient experience, it's understanding the limits of what you can do within your current resources. It's got to be part of the core discussion. It's not, and here's the Press Ganey stuff. Here's the human experience stuff. It's got to be, we're presenting data on how the cardiac service did today. One of the top 50 outcomes according to health grades in outcomes in cardiac surgery. A lot of people don't know that. There's Westchester because it's next to New York. The New York places get all the, press, but some great programs here. But we don't routinely just say, oh, and what's our patient experience? It's not a routine part of the presentation or the expectation of presentation, right? Quality outcomes, yes, but softer subjective outcomes of, well, how do our employees feel about working on this service line? Do they feel honored? Do they feel praised? Do they feel a good part of the team? How do our patients feel? How do our loved ones feel? How's the experience in coming in for surgery, right? We need to make that, if you will, an absolute integral part of every time we have a discussion of how are we doing.
As we wrap up, the three things I'm taking away from this are seeking the truth, believe in the data, then prioritize and get to work. How does that sound to you? And is there anything I'm missing?
No, I think that's really it. And radical transparency, sharing it, not hiding it, not be ashamed of things that you may not be doing perfectly. There is no perfect organization. I don't care which organization you go to. There are problems in any organization that's of sufficient size. The key is a constant commitment to address them. And I think every organization can do that. And every organization can be better tomorrow than they are today. It just takes a little bit of courage and a lot of effort.
David, thank you so much for today, your collaboration, our partnership with Press Ganey, and your leadership.
Thank you. Thank you for having me.
That's a wrap. Thank you for joining us today, and special thanks to our guests for sharing their time and insights. Stay tuned for our next episode, which will be released soon. In the meantime, visit our website where you'll find more information on the human experience and a lot more.